Okay, maraming salamat po sa inyo lahat. And I would like to thank you for inviting us here and giving us your most precious time. By the way, I'm going to talk about myth, and facts about ivermectin. And the thing is, I'll try to make it as short as possible, maybe 15 to 20 minutes. So let me start with saying this: insanity is doing the same thing over and over again and expecting different results. And that's by Albert Einstein. As you can see, what's going on, what's happening is we have a spike, we do quarantine, lockdown, do our basic protocols, and then after that, when the numbers go down, we try to loosen up, and then again, if there's a spike, we do the same thing again, quarantine and lockdown. Now, COVID new cases, we have an all-time high this month of September, and despite of you know face mask, face shield, lockdowns, and quarantines, the numbers are getting higher. And again, Insanity is doing the same thing over and over and again. So what I do, I'm a data scientist. I'm into health informatics. I'm into blockchain, health and governance, and I'm into IoT, Internet of Things. I'm with a nonprofit organization, which is Kinsangan Foundation. And with regards to ivermectin, I'm part of the World Alliance, Healthcare Alliance, which was recently formed by BERT Group, British Ivermectin Recommendation Group of Dr. Tess Lori. I was also a coordinator with on during World Ivermectin Day, moderator of that conference. I was even moderated. I even moderated with Dr. Iggy and Dr. Homer, who was there with the Indian group. Now, what to expect? I'll do my best to have this in a very 15, 20 minutes. And the myth that the things that we're trying to answer is, if this is so effective, bakit tinatanong natin? Bakit hindi natin to alam? There is insufficient evidence. Tapos meron sinasabi na it is used for veterinary, para sa mga hayop, para sa mga biik, baboy, pinapakita pa nga, lalo na sa kabayo. And by the end of this presentation, I hope I would be able to give justice and at least everyone to give you a good bird's eye view of what really ivermectin is. So is this only for animals? And if it's only for animals, why give it to humans? Really, is there no sufficient evidence? And how come we did not hear about this? Yes, it is for animals. Why give it to humans? As you can see, pinapakita sa CNN, mainstream media, ito pinapakita, lalo na sa US FDA, merong kabayo. But the thing is, this has become a big issue even in the States when Joe Rogan, who said he used ivermectin, all different mainstream media news talked about this. But the thing is, ivermectin has both for human grade, human pharma grade, and at the same time, merong panghayo. So dalawa po siya. Yun yung pinagtataka namin, bakit po parating pinagpipilitan na para sa hayop lang to. Okay, inaayos ko lang po yung screen ko. Give me a few seconds and then I'll move ahead. So on my next slide, it is a pharmaceutical grade ivermectin. It has been distributed in Mercury Drug, Watson's Pharmacy, hospitals for compassionate use, patients who will undergo clinical trials. In the USA, the different dosage are 3, 6, 12. Sa Pilipinas, there's 15 milligrams. I think there's already 12 milligrams po, and even 18 milligrams. Please correct me if I'm wrong. But I know personally we have 15 milligrams yung pong binibigay natin. At the same time, FDA grants a hospital compassionate special permit for ivermectin use. Hindi para sa hayop, but rather para sa tao. And this was already given last April pa na ni Director General Eric Tubigo. And ivermectin gets FDA not for human consumption. So yung sinasabi po nila na para sa hayop, hindi po totoo yun. Hindi lang para sa hayop. It already got a nod from Philippine FDA, not for human, not only for animals, but also for human consumption. Now, however, ito lang ang catch, as experimental treatment for COVID-19, oral ivermectin is allowed by FDA. Only 2 instances. If a medical facility is dispensing the drug secured for compassionate special permit, or if a doctor has prescribed it and the drug is compounded by a pharmacist according to the prescription. Now, regarding hearsay evidence, sinasabi po nila there's no sufficient evidence that ivermectin works. The thing is, tingnan po natin to. This is this is not an updated thing, but res ipsa the evidence speaks for itself. Ivermectin has been used since 1992 during there's only 19 deaths and adverse effects compared to remdesivir and COVID-19 vaccines. And later on, our good doctors they could add more on the data. Now, ang kagandahan po nito, si Mr. Rick Casabuena, he did a study on the different ivermectins being distributed in the Philippines. Tiningnan po niya yung which brand rather, has really ivermectin. So nakita po natin dito, these are the different brands that has ivermectin, and these are the different, should I say, dosaging po. Nakikita po natin dito. And maybe Mr. Sir Rick later on could also talk about this. And he did a residual heavy metal analysis of various ivermectin brands. Kasi we try to make sure that the ivermectin that we take or even prescribe to our patients are the ones who have a good quality. And there's several brands coming from India who has arsenic. So it has arsenic rather. So those are the brands you should try to look, remember, and don't prescribe them, ever one. And the rest are the best brands from Dr. Landido, LifeCore. Ito na po lahat, and we can give you the slides later on. So for us, evidence, sinasabing walang evidence. For me, there's 3 evidences: testimonials on positive results, physical evidence wherein ivermectin is used for treatment, not just one, but rather a significant number of people, and studies conducted, that is, yung treatments are randomized controlled trials and systemic review or meta-analysis. Testimonials, this comes from our patients saying this really works. These are at least 2 of our patients na sinasabi nila how it affected them, worked for them, not just for them, but also their families. And on ivermectin, VG access, let's look at the profile. 4 billion doses, 5,648 reported adverse reactions, which is 0.001412%, because it was given 4 billion doses prescribed, and it has been given for 3 decades. Now let us look at the other evidence. It has been adopted by several countries already. No, hindi lang, minsan tinatanong natin, bakit hindi natin to alam? I don't know what's going on. No, it has been adopted for at least 20% of the world's population, and these are the different countries that has used ivermectin. And we are going to show you later on the graphs. Pasensya na po kasi mukhang nagka-senior citizen moment ako, or brain fog. Anyway, these are the different countries that used ivermectin. Ito sa Mexico City, wherein they made a study on it. Mexico City-wide innovative population level study administers ivermectin based home kits with drastic reduction of hospitalizations. Now, this is the COVID-19 kit, which includes paracetamol. It has 4 ivermectins. They have antibiotics, azithromycin, and a care guide. Meron pa nga El Salvador, they also use that. So what happened in Mexico City? There was a drop of the number of cases when ivermectin was used. And after that, there was a spike when a vaccine was started. Now, the death, as you can see, December 28, when it was used, bumaba yung cases nila. But, Mexico City is one of those countries that is very interesting. But the other country that I'm really interested with reporting to you, my dear doctors and Honorable Mayor, is India. Ito yung napakalaking news noong April na sabi na nagkakagulo na, all hospitals are filled up and most patients are already outside and they are treated along the hallway and even on the streets. Does that sound familiar? I think so. However, what they did is they had a study being done, and this was published last February 16, 2021. Role of ivermectin in the prevention of SARS-CoV-2 among healthcare workers in India. It's a matched case controlled study. 2 doses of ivermectin showed 73% reduction of SARS-CoV-2 infection among healthcare workers. And ginawa po nila sa AIIMS or All India Institute of Medical Sciences, I think that's the UP of India, they use ivermectin for their mild diseases. Not for moderate, not for severe COVID, but rather for mild. So ano pong ginawa? Ivermectin, 200 micrograms per kilogram once a day to be taken for 3 to 5 days, and they have the option either to use ivermectin or hydroxychloroquine. And ito yung ginamit nila, ito yung kanilang pack. These are, the different posters that they distributed. And what can we see? There's a 98.02 reduction after AIIMS protocol was being implemented. As kung nakikita po ninyo, dito sinimulan yung ivermectin. And September, ngayon po, nandito ang cases nila sa India. That's in Delhi. Same thing with the death rate. 100%, zero, wala hong balita na may namatay. Goa, India, same thing. May 10, they use a preemptive ivermectin for adult use in that state. There was a 97.4 decrease in new cases. Death, 99.9%. Aren't those significant numbers? This one region is also very, very important, Uttar Pradesh. You could also look it up right now. You can go to Google, just write down COVID-19 cases, and you can see the charts for yourselves. No, there was a drop. Before, it was at 37,944, April 24. They used ivermectin for 3 days, 12 milligrams, as advised by AIIMS. There's a 99.8% drop of cases. And the death right now, zero death, average 1. So basically, it's 99.99%. Question is, India IVM picture, it showed a good result, 99% average significant decrease of COVID-19 cases and at the same time death. So isn't that mind-blowing? And this is news right now. 31 districts of Uttar Pradesh are COVID-free. And hindi lang po ito haka-haka, it's all on the different news. And the thing is, you could just search for it and it would show you the numbers that, they have declared that their places are COVID-free. Now, this is the thing, 32 districts in Uttar Pradesh, they announced COVID-19 free, proving the effectiveness, they call it the deworming drug, ivermectin. Now, for just, if people still here are listening, can you please give me a type number 1 if you think India is a success story, or type number 2 if it's not, please let me know so that at least I know na nakikinig po tayo, and then we will know what your stance is, anong tingin ninyo. Oh, thank you so much. Maraming salamat po. So this is another story. Indonesia ignores warning in the rush to buy anti-parasite drug for COVID. When they use the anti-parasite drug named ivermectin IVM, talagang bumaba yung numbers nila. And bumaba yung cases, bumaba po yung death rather. Japan, these numbers came out after, the Tokyo Medical Association announced that ivermectin can be used on their doctors, and you can see a drastic drop of COVID cases, both hospitalization and death. Now, at present, dito po I think this is from Massachusetts. Tama, sa Massachusetts. We are undergoing COVID trial. There's an ongoing clinical trial, and if you have relatives who are there in Massachusetts, have them enroll here, they'll get $400. Excuse me, na-asthma ako. $400 for enrolling. And they're using ivermectin, metformin, and fluvoxamine. Now, hearsay. Now, question for you, is this a hearsay, what we're talking about? Did the mainstream media report this or interview the different health ministers of those regions in India, in Indonesia, even in Mexico? Did we send delegations to India or invite health teams to come to the Philippines? Remember that the DOH sent doctors to Cuba. Remember that earlier during the peak of COVID in the Philippines, we invited the Chinese team. Give me 5 more minutes, and then I'll be done. The thing is, those are the things that we're not done. It's not done. And regarding censorship, as you can see, Gavi, the Vaccine Alliance, is paying for AdWords against ivermectin. And any one of you who are into IT developers know what, or even social media marketing, you know what AdWords is. Gavi also is the global alliance of vaccines. So you could also look it up. Now, censorship, matindi talaga. I got censored several times because I was talking about ivermectin, talking about the vaccines. I got canceled. And this is the most common thing that they do. They'll say, you have violated community standards. I got canceled. So my YouTube, I was able to get in just yesterday. And for my Facebook, just 2 hours ago, I was banned for 7 days. And my YouTube account was banned for at least suspended for at least 2 days. So you get filtered out, you get censored by everything. And the thing is, when they censor the news, the data cannot reach to you. Yun yung kaya tinatanong natin, bakit hindi namin alam? Well, you have censorship. That's what's going on. Slovakia, another country that uses ivermectin, and you see the numbers. So I'll just keep on showing the graphs. You be the judge. You will have an informed decision on what ivermectin does. And we have the news. Nandyan po yan, pinapakita po natin para hindi po sabihin nakakaka lang po sinasabi natin. And Czechia or Czechoslovakia also used ivermectin. It was approved. Even in Zimbabwe, 98.74%. And these are all countries who used ivermectin. Ang ginamit pa nga sa Zimbabwe earlier, it was SEED protocol, they call it. They use silver, ivermectin, and doxycycline. And they used a higher dose in treating COVID. And they showed positive results. And one of the doctors there, oh, I forgot her name. Anyway. So Zimbabwe, let's move forward. Belize, the same thing. Now, with regards to the trial studies, no sufficient studies. It's being used on different countries. This is the current study. You can go to IBM Meta. It's right there, ivermectin for COVID-19. 63 trials, 613 scientists, and 26,398 patients. Ivermectin has more studies, more research than your vaccines, than your remdesivir. And everything showed, all of these studies showed that ivermectin showed improvements for prophylaxis, early treatment, late treatment, even mortality. So ivermectin is used for those 3 stages: early infection, pulmonary phase, and hyperinflammatory phase. Now, I want to emphasize this. We have to be careful to protect our patients, as well as not to deny them effective treatment regimes. So, tama po sinasabi po natin, okay, first, do no harm. But second is, we should also remember that we should not deny our patients effective treatment regimes. Now, did the mainstream media report about those things that we mentioned? I'm trying to reemphasize something here. So, if this is so effective, why are we not using it? I don't know. We are currently using it. And my question is, why isn't the Philippines, the government, really using it? And we are trying to, spread this news out so that, it needs a lot of, sama-sama po tayo dito. So this is one of the cases, sabi ko, to have and to hold in sickness and in health. Ito po yung sa home care management natin. And I asked the patient if I could share the photo and picture. Severe COVID-19, 80% saturation of TUSAT, 85-year-old, diabetes, obese. We started the ivermectin protocol for at least 3 weeks. And these are the different supplements that we added. So what happened to the patient? What happened here? Home care management, virtual consultation, 3 week. As you can see, wean off na yung patient from oxygenation. And till death do us part. If you have a patient being taken care of sa bahay nila, you have nawawala po yung anxiety, and the patient could feel the love and care of the family. And eto pa nga, I don't know if you could hear the audio. Eto si mama, pinapakain ng kanyang husband, yung tatay, talagang mahal na mahal niya. And this is very important. Kahit may mask, nakakatulong pa, di ba? So that's the home care management, and that's one of our patients. So let me remind everyone that the President of the Philippines left ivermectin use to doctors' patient discernment. So nasa doktor na yon to discern if they will use ivermectin. There's a go signal coming from the president. Ivermectin gets FDA nod for human consumption. I did mention that, and we have Misamis Oriental who endorsed ivermectin. Gumawa na po sila ng kanilang board resolution doon. And at the same time, yung provincial health office nila, and they used what they're just trying to reinforce what the president said. PPRD leaves ivermectin used to doctor-patient discernment. And we have Misamis Oriental Governor who also endorsed ivermectin. And please let me know if you could hear this one. This would be just 2 minutes. Sir Manolo, can you hear it?
Go ahead, put it on. I can't hear anything yet. What this video that Doc Vince is going to put on, these are the results of the meeting yesterday at the.
Vince, wala.
There's no sound yet, Vince, huh? Put it on.
I think there's no sound. Hindi ko ma-share yung sound po kasi.
Anyway, let's just talk about it.
Yeah, just go ahead, Sir Manolo, please.
No. What we've done, we were able to meet with the Batangas governor last Friday last week, and we spoke to him and we said we have to do something different. And he was saying, okay, I will take this up with the provincial health board, and we will see what we can do. So this video that Vince wanted to put was were the activities that held during the meeting yesterday. In Batangas, they finally approved the LGUs to the governor and the provincial health board. They finally approved the use of ivermectin for home care. So they're going to start distributing ivermectin to everybody in Batangas. No? And what's going to happen is they are not able to use the money, the provincial funds. They cannot use the provincial funds, but they can get private donations for the purchase of the ivermectin and whatever other drugs. No, now the person who can tell us more about it was Rick Casabuena, who was in the meeting yesterday. So Rick, please tell us a little bit what happened and what is the resolution. Ano nangyari? Pakisabi lang sa lahat.
Magandang hapon po ulit sa inyo lahat. So kahapon nga po, we had a meeting with the Batangas Health Board, which is headed by the chairman, the governor himself, Governor Hermelando Mandanas, and they discussed the use of ivermectin or the implementation of ivermectin for the province of Batangas on a research basis, okay, so that they can start. And what happened in that meeting is the chairman, the governor, asked each and every member of the health board whether they agree to use ivermectin. And the answer was unanimous. Unanimous po sa lahat ng doctors. They would like to start. And yesterday, the governor approved the resolution that they will start the program in Batangas to use ivermectin. That will include the public hospital, and on the private one, it's to the discretion of the private doctors. And the big part of it is what they call home integrated system, which is basically home care. So yun po, simula na po sa Batangas. At ngayon po ay kumbaga laganap na po yung balita since yesterday, and the people are so happy knowing that news. Yun lang po. Thank you.